thing that I really wrestle with as a clinician and as a person who's in this field is the fear of liability. And so you don't see this in Europe as much, you don't see it in other parts of the world, but in the States, you and I do a lot of training and a lot of workshop training. I'm just so struck that most people that come to my suicide workshops are people that are there because they're afraid of liability. If that gets them in the door, that's fine, and I'm not naive about this. I've been a consultant on an expert witness on both sides of the coin. I've been on plaintiffs' cases, I've been on defense cases. It's very unpleasant business. What I wonder about is if there's a way that a courageous clinician could take on a case like that without fear of liability. And to me, it goes to the point I made earlier that David Rudd and I talk a lot about together, which is there an informed consent process with her and with her family? Well, his argument, and I'm all with him on this, is that if you really sat down with her and her parents and sort of went through that whole deal and said, in effect, now a lot of clinicians won't work with your daughter. They'll find a way not to see her. But if I were to work with her, or if I'm going to work with you, these are my conditions. And to be crass about, I would suspect you're going to be much less likely you'd be sued should the tragedy occur, because you were clear in the front end. You gave them informed consent. You engaged them in as an arm of the treatment or as a support of the treatment. And you've kind of been frank and honest. I mean, would you ever think of suing your oncologist because he or she failed to save your loved one from prostate cancer? Cancer's a killer. And not all mental disorders are killers, but they're implicated in a number of suicides. And I think it's interesting, that parallel model. We in suicide prevention think that every single suicide should be prevented. I'm committed to that. I would love a world in which there were no suicides, but I'm also a realist, and so I think not naive when I say that I've not lost a patient to suicide, but I've had a number of very close calls. I don't think I'm immune, just because I know a lot about it. I do think that if you give somebody a genuine second chance, and are engaging them in the ways that you and I have been discussing, that you give them the best possible chance to find a way to make their life worth living.